this hospital, it used to be a district hospital. But wherever I'm going, I go there for monitoring. They are really let down by the fact that every year we put their increment of staffing in the budget, but we don't attend to it. Much as we've mentioned here that we shall be adding 4.5 billion, I'm praying that, Right Honorable, this time we use our appropriatory powers to see that all regional referral hospitals, their staffing matter is given priority, because we shall always talk about this, but at the end of it all, budget and anyone else will tell us that there is no money. But we are even affecting our international delegates because they are being treated in one of these key hospitals like in Tebe. And secondly, Right Honorable, I pray with your indulgence that on page 21, we get back to this recommendation of having days fixed for boat ambulances, because it would be weird when someone reads this recommendation and we leave it like that. I ask if the House agrees. We change this to read that, that's on page 21. We amend, yes. Thank you so much, Right Honorable. I pray that we amend to read under part 3, Ministry of Health should designate specific areas for boat ambulances, and it should make sure that it sensitizes the public to be aware of the areas. I beg to request.
Thank you. The questions will come later. Honorable Nyeko Derek, Honorable Makoha, Honorable Wadiomu, Honorable Nyangweso.
Thank you, Right Honorable Speaker. Allow me to thank the committee as well. Right Honorable Speaker, if we mentioned in this House that Kampala could be one of the far areas to reach, we would all be amused. Right Honorable Speaker, Chirudu Hospital, it is not reachable. Just last week, Right Honorable Speaker, colleagues,
Honorable Minister for Works, we have a hospital which is not reachable and also not reachable, it seems. I can see you.
Right Honorable Speaker, in the recommendations I did not hear Kampala, but it is for the fact that we lose more than 4 hours in jam. And this is caused by Genome 7. They block the road for 4 hours. Literally in Kampala, we lose more than 6 hours of jam. Right Honorable Speaker, part of the critical people that want to access health centers like in Kirudu. Just 2 weeks back, we lost a gentleman around Zambia. While seeing the hospital, the road was blocked for 2 hours and people could not access the hospital, while they could see the hospital. But this is Geno. Kirudu is one of the referral hospitals, but people cannot access it on a daily. The road is closed for 4 hours. I want to call on the ministers. Maybe General Museveni does not know the pain that the people are going with for the expense of him traveling to Kampala. Let him find other means, or else we are losing so many people. So far we have, yes, colleagues, this is something, colleagues, this is something that looks minor, but we need to look at the
point of order, Honorable Adiomo.
Thank you, Right Honorable. Right Honorable, we are in this country, and as per now, we are trying to budget, meaning that the budget we are discussing about is from the executive. And we know that the head of the executive is President Museveni and the Minister of Health. He operates on the behalf of the President. Therefore, is the honorable courage in order to say that the President is not aware that really it's a pain for Ugandans to suffer?
Thank you. Now, honorable colleagues, please. I would implore you, okay? I would implore you that really the floor here cannot discuss the security of the President. His movement is part of his security. It's not a matter really we can come and discuss here, okay? So Honorable Nyeko, conclude.
Right Honorable Speaker, as I conclude, Like I said, this is a health issue, and our people are passing on because they cannot access the hospitals in time. But as well, Right Honourable Speaker, I want to call on you colleagues. If an ambulance cannot pass through the motorcade, the jam created by these insecurities that we claim that the president is going through, then we should find other means that do not inconvenience Ugandans. Right, Honourable Speaker, this is something we need to take seriously, or else the communities are going to feel very insecure, and it is going to cause more insecurity for the president. I thank you.
Thank you. Yes, Honourable Margaret Makoa.
Thank you, Right Honourable Speaker.
Honourable colleagues, I have a list. You don't need to stand up because I'm recording. I've already written you down on the list. Yeah.
Thank you for giving me the opportunity. And I also want to appreciate the chairperson and the committee for the good report. The committee observed that Namayingo is among the hard-to-reach districts. I want to appreciate the committee for that observation. And it is very true that Namayingo is one of the districts that received the water boat ambulance. And we received it with joy. We thought it would help our people. But as we speak now, Right Honourable Speaker, the water boat ambulance has no fuel. Last 3 weeks, I was in the islands of Lolwe, and people were telling me, tell your government, the ambulance is not helping us, because they're asking the public to provide for fuel. And now they're starting to ask us to buy the canoes and engines so that they can go back to the old methods of saving lives. So I want to ask the Minister of Health that please, can we find the fuel? Can we make sure that these ambulances are of help? And then also, Right Honourable Speaker, the second challenge is that Namayingo has one constituency in the islands and then 2 on the mainland. When you reach on the mainland, we have no ambulance to complete the travel cycle. So coming out of the water boat ambulance, then you are put on a motorcycle, a bicycle, it makes no sense. So I want to ask that you provide Namayingo with a road ambulance so that we can make the travel cycle complete. Right Honourable Speaker, Namayingo has various scattered islands. Yesterday I was in 2 of the islands, that is Yebe and Bisa. They do not have not even a clinic, and they were requesting me to put there at least health center too. Now, me, a member of parliament, where do I get the resources to provide a health center too for my people? I want to ask the minister in charge of health, as we are looking for the resources, consider the people of Namayingo so that those scattered islands, which also have Ugandans who are paying taxes, can also be attended to. Or else, as members of parliament, at times it's even becoming very hard for us to check on these people because their cries in the health sector is beyond our ability to handle. Lastly, Right Honourable Speaker, some of these islands, it's not easy to come up with the toilets because that.
Thank you. Honourable Nyangwesa.
Thank you, Right Honourable. Right Honourable, allow me to add my voice to the honourable colleagues by thanking the committee for its observation and recommendations. Right Honourable, especially on the drugs in the hospitals, both referral hospitals and general hospitals, and even in the health centers. Right Honourable, you are aware that the national store, national store, medical stores is mandated to procure, store, and distribute medicines, essential medicines, to all the hospitals and the referrals and the general hospitals. But, Right Honourable, as we go to the communities, one of the problems is the scarcity of drugs in those health centers. Although sometimes as parliament we do allocate money for drugs, but the national drug medical stores, what they do instead of procuring the drugs according to the requisitions given to them by the referral hospitals, by the hospitals, again they supply other drugs. Meaning that at the end of the day, the required drugs in those hospitals, they are not taken there. Right, Honorable, I will give you an example of the general hospitals. That is Buenge General Hospital. When you go there, after reaching there, they will tell you to go and buy drugs from the nearby pharmacy. And just recently, Right Honorable, we lost a life. One of the attendants was told to cross to go and buy drugs from across the pharmacy. As she was trying to cross to go and buy maybe the drugs from the pharmacy, she was knocked. And then the attendant, the person who was attending to a sick person, she was brought back again in a critical condition. Therefore, Right Honorable Speaker, as we budget, as we allocate money, there is a need for the ministry to take a keen look into those people who are creating, who having pharmacies just across the general hospitals and the referral hospitals. Because when you go to...
Thank you. Honorable Nyangwese, Honorable Stella Tiang, Honorable Chemonges, Honorable Mosokot, and we are done with that.
Thank you, Mr. Speaker. I applaud the committee for the report. Mr. Speaker, when the Ministry of Finance was shifting from the sector-wide approach to planning, to program approach to planning, they told us that the budgeting is going to focus on outcomes as opposed to outputs. Looking at the committee report on page 20 and 21, the committee has noted that the ministry procured 115 ambulances. But Mr. Speaker and colleagues, these ambulances, first of all, not all of them were deployed. Therefore, we do not really see too much of the outcome. The few which were deployed were not facilitated to function. No money for fuel, no money for maintenance. Some of them are not functional. Busia district was to get one for Samia Bugwe South. We have not received that ambulance, Mr. Speaker. So I want to support the committee report that at least the 17 billion shillings which is requested here to make the ambulances functional by way of providing some fuel and maintenance. Otherwise, just the numbers procured does not translate to improvement in livelihood of our people, which is the focus of the budget. Secondly, Mr. Speaker, towards the end of 2023, the Ministry of Health procured X-rays under the Global Fund. But these X-rays have not been deployed to date. I've been here on the floor of Parliament. The Prime Minister responded and told us ambulances, X-rays including for your hospital in Masaf in Busia have been procured, but they have not been deployed. So there is no outcome of this one. So we have expenditure, we have budget performance reports from ministries, but there is no outcome that our people are getting from this budget. So I want to implore the House that when it comes to budgeting and oversighting, let us focus on the outcomes of these decisions. Thank you, Mr. Speaker.
Thank you, Honorable Stella Tiang.
Thank you, Honorable Speaker. Thank you, Honorable Speaker, for giving me the opportunity. I want to join my colleagues to appreciate the committee for the work done. Honorable Speaker, I have a few concerns. One, the committee report states that 16 oxygen plants were installed and operationalized. That excludes Moroto Referral Hospital. But Moroto Referral Hospital got also this type of oxygen plant installed and not operationalized. It's 2 years down the road. I want to ask the ministry when the oxygen plant will be operationalized, because apparently the hospital is paying for provision of oxygen to the patient. And yet it's even not enough, and it's affecting the operation of the hospital. Secondly, Moroto Regional Referral Hospital has a broken down X-ray machine, an ultrasound machine. For 3 years down the road, we have been reporting this to the ministry with no positive response. And yet these services affect more the majority poor, who are not able to go to private hospitals to access these services. When are you going to respond to that to save the majority poor? Thirdly, Honorable Speaker, we are talking of low staff levels. We have the staff who actually have double jobs. They are working in government hospital at the same time having their private health facilities. I don't know when and the double jobs actually is affecting the effectiveness of the hospitals, because you'd find that this, especially the Tekenco, the specialized staff, the doctors, you'd find that these people are not in the hospital as required. They will have 2 days in the hospital and 3 days, other days in their private clinics, affecting the services of the hospital to the people. I would ask the ministry when they would take action to discourage this kind of double job workers, to ensure effectiveness of these health workers in the hospital. And then fourthly, we have many stalled hospital structures across the country. And the ministry has continued planning for new structures across the country, leaving the old ones not completed. I don't know why the ministry cannot decide that we...
Thank you. Honorable Chamongis. Honorable Mosokot.
Thank you, Mr. Speaker. I join my colleagues in supporting the report. However, Mr. Speaker, I have noted that the very critical areas in health, especially in Sabey, have been left out. I don't see anything supporting us. For example, when we came up with the policy to hold the creation of district hospitals, we accepted because we knew this would be a chance for us to have health centers in all the sub-counties, which is not happening. And even, for example, in Bukwa district, we already had a district hospital. But sometime, it said around 2023, it was downgraded back to Health Center 4, Mr. Speaker. Yes, and now Bukwa, which is a district bordering Kenya, does not have the district hospital. And is a very highly populated area, Mr. Speaker. Mr. Speaker, I have also noted that the statement does not include the creation of a regional hospital in Sabey, which has been, we were promised when we started this parliament. We were told that the referral hospital for Sabey will be in the budget. And now it is not there, Mr. Speaker. Finally, Mr. Speaker, even the health center force that we were promised does not appear anywhere, and this would help us areas without the district hospitals. For example, me from Queen, we are really waiting, and we are still patient, waiting for a district hospital, which we saw with our hearts would be covered by having the more health center force and the health center 3s. And I want to end by also adding on to what the Honorable Mdimu said about the Mbala Hospital. The situation in Mbala Hospital is really bad. And now this is the referral hospital supporting all of us, the entire Sabey districts, all of us, we come to Mbala Hospital. I really want to support, request that even as we wait for others, really help us allocate this 5 billion to complete this structure in Bale, because it is highly.
Honorable Mosokot, Bunyoro, I had forgotten Bunyoro, Honorable Kiki, and then Rob.
Thank you, Mr. Speaker.
Just let me first make it clear. Colleagues, I did the round, and then I looked at regions which had not been captured, sub-regions. So I went, that's why I picked Sebei, I picked Karamoja, to ensure all of them, at least every region on health, are captured. Thank you.
Thank you, Mr. Speaker. I join the colleagues to thank the chairperson for the committee. Mr. Speaker, to start with, you have been emphasizing about the PET machine for the testing of cancer. But there's this one also about the dialysis machine for those who are, all of us are victims of kidneys and kidney failures and a problem into it. I also recommend we put some fund so that most of our regional referral hospital, we put this machine, because like in Kitgum, Agago, everybody has to run and goes towards Oyam. Number two, Mr. Speaker, there was a project which the minister have to fast track it about the teaching hospital in Gulu University, to have that wing. We held several meetings about it, and even the sub-region acquired a land waiting for that project to be launched. Maybe you get some time and fast track it. Number three, Mr. Speaker, I support the idea of creating Kitgum Medical Hospital into regional referral hospital. Many people who are coming from Eastern, actually, they have to go not even to Gulu Regional Referral Hospital, but they go to Lacho instead. That tells us even the services are regional referral hospital. Much as we are emphasizing the private wings of hospital to be developed into proper services, those services are regional referral hospital. We have to check and improve into it. Mr. Speaker, there is a change. The government has changed the policy of health center 2 into 3. I think they have to revisit this policy. We have policies, they don't even have health center 2. Even those with health center 2 have not been changed into health center 3, and the policies are also as big as sub-counties. A point in case in my county. Finally, as I conclude, Mr. Speaker, I have written to the Minister of Health. They have talked about it. Kalon Town Councils, since all this period, they don't have government facilities like health center. 3 or wherever kind of health center you need to place. Why don't you put some small money? This is the center, it is the center of Agago North County. Beside the ambulances which you have not given unto us, let us roll it out. Many of us are now talking about those.
Thank you, Honorable Kiki.
Thank you, Mr. Speaker, for the opportunity. I wish to thank the chair and the committee members for the good report. For starters, wealth is health, or health is wealth. I address myself to Masinde Hospital, which was built 1922. Actually, it has outlived this existence. I'm happy that it has been highlighted as one of the beneficiaries. We just hope that our dream will come to pass this time around, because it has been appearing in all these financial years, but nothing has come to pass. Number 2 is on the national insurance. The Committee on Gender, Labor and Social Development visited Zambia, and actually we found out that Zambia, the national insurance is working. Zambia is one of the poorest countries. And we have a good report. I don't know whether it has ever been represented here, but Zambia is doing very well on the national insurance. So let us maybe have another debate on this insurance. It is workable, it is practical, and it will solve a number of problems. Number 3, in the report, I don't know how we can budget for prevention is better than cure. Mr. Chair and the Minister, do we have a budget for prevention? Because some of these diseases can be prevented so that we don't go to hospitals. Is there a budget for prevention? What have you put under that item so that we have very few people going to hospital and we can prevent the disease? Now, and lastly, VHTs. Have you put anything for VHTs? They do a lot of work in our communities. Thank you so much, Mr. Speaker, for the opportunity.
Thank you. Thank you. Now, honorable colleagues, I just wanted Honorable Amos who raised the issue of dialysis and what. Now, Minister for Finance, what is so special about the PET machine? And last time we were here with you, and you remember how emotional Honorable Kawoya became here on the floor and said, anyone who has not yet gotten cancer is the one who doesn't know what a PET machine means. Because a PET machine is basically for early diagnosis. If you get cancer early, then you're able sometimes to treat it successfully. Most of the times we get it when it's late. Because you want a PET machine, you go to Nairobi. The cost of Nairobi, how many people will afford? What I checked, Minister of Finance had put around 37.5 billion, I think, in the budget, whereby 4 billion was for reagents, and then 33.5 was for construction of the center. But the question is, how do you buy reagents before buying a machine? I don't want us to go to a situation which we had here when we were handling the policy statement for agriculture, where they brought castrated bulls for the breeding program. That would be really a bit close. So, Honourable Minister, I request you cross-check with your team on the issue of the PET machine. Good, yes.
Mr. Speaker, yes, I remember you raised the concern here and you asked me to follow up. Mr. Speaker, the Minister can confirm, the Minister of Health can confirm that we have made a provision in the next financial year's budget, which we are considering now for the machine. Thank you.
Yes, Honourable Minister, I agree, and that's why I've appreciated 37.5, but they are saying they need 60. I want us to sort out the issue of the PET machine, Honourable Dr. Young. And then the Minister for Health will tell us, if Minister of Finance gave you money for the project, how do you start by buying reagents when you don't have a machine? Because in the budget, I see money for reagents.
Thank you very much, Right Honourable Speaker. We had an interaction with the ED of Uganda Cancer Institute about the PET machine. But I can't say I was talking a lot of English, but we requested that he can write a comprehensive report of the progress on the PET, it's in fact the PET project, and he can be able to present to the committee. Then after that, you can be able to present to the floor parliament. That was my humble request. Thank you.
Yes, I will request to read you also reach out, you meet the Minister for Finance. Because the money being asked for looks a lot of money compared to what the ministry has already given. Okay? So, and you need to go into details, Chair. I can see 4 billion for reagents. Now, reagents, before you get a machine, how are you going to use them? Laboratory reagents. Honorable Rope.